Okay, well, welcome back to the Valley Wellness Podcast, sponsored by Valley Wellness and Hormone Clinic. We're excited to be back. And just to reintroduce who we have here.
Tennille Cloward, OBGYN.
Jen Krebs, Certified Nurse Midwife, APRN.
And Sean Haskett, also a board-certified OBGYN. And super excited to be here to talk today about peptides. Big buzzword right now. And surprisingly, peptides are more familiar than people realize. They've been around a lot longer than people realize. And honestly, myself, I think really haven't learned much about them until this last year. So this is kind of new for me. But we have some experts here to talk about peptides. So I'm excited about that. So let's just start with the basics. Peptides, what are they?
Peptide is a general term for short chain amino acids. Amino acids bonded together with peptide bonds, either between 2 and 50 amino acids would be something that would be defined as a peptide. You get more than that and it becomes a protein. And so that's just a really, really general term.
What that means, though, is they're naturally occurring in the body.
Yes.
These are things that we already
most
have
of
in
them
our
are.
body.
Most of them are. We'll find there's SS31 is actually not. We'll talk about that. But most of them are naturally occurring in the body. Peptides are more malleable in the way that they have an influence because there are fewer amino acids. They're a little more flexible in their structure. So when you introduce a peptide from the brain somewhere else in the body, it can actually permeate more membranes because it's smaller than a protein and can exert an effect in those tissues, whereas proteins are more static in their structure and function. And you can't take a protein from one part of the body and introduce it to another part of the body and actually have it exert any sort of therapeutic impact.
Yeah. And surprisingly enough, there's peptides you've heard of. Insulin is a peptide. So
Yes, it's been around for a long time.
Been around for a long time.
The weight loss medications that people are all buzzing about, the semaglutide, tirzepatide, the brand names Ozempic and Mounjaro are all peptides.
Mm-hmm.
Things that we use gynecologically, Lupron is a peptide. Forteo that we use for osteoporosis treatment, also a peptide. So really there are lots of peptides. But I think today what we're going to talk about are the kind of edgier peptides.
Edgier. I like that. I would like to say more they're just newer peptides.
They're newer.
Recently introduced to at least me, but I think Jen's probably been more familiar with them for a little bit longer than I am. So that's why I'm excited to talk to you about them. So let's just get right into it. Maybe just kind of talk about some peptides that you have some experience with or that you feel like are valuable for people to know about.
Yeah. So one of the interesting things about peptides is they become kind of a legal controversy. Peptides, because most of them are naturally occurring in nature, they are very difficult to patent for drug companies. One of the things that you need to establish in order to get a patent is novelty. And because naturally occurring substances are not novel, they are difficult to patent. And therefore, it's really hard to put your money into testing something, producing something, getting it FDA approved if, you can't patent it and therefore get a return on your investment. Right. So many of these peptides have a lot of human studies to support their efficacy and their safety, and many of them actually do not. Not formal studies. So a lot of the information that we have on some of these peptides that we can really geek out on for optimizing health and tweaking physical performance and the way that we feel and brain and function and body function have been used by humans for a long period of time, since the 70s and 80s in these longevity communities and biohacking communities and on these sweet bodybuilders that are willing to use themselves as test subjects. And so a lot of the data that we have on their efficacy and safety comes from these communities rather than from formal studies.
Yeah.
Although on a lot of them, there is a mixed amount of information. Formal studies, biohacking communities. But the nice thing about peptides is that they are relatively safe because of their structure and function. Yeah. So because they are short-chain amino acids, they are absorbed by the body very readily and easily. They're broken down very easily. We excrete them very easily. So they have a very short-acting effect. And it's really, really difficult to obtain toxic levels of them because our body's so good at recognizing them, breaking them down and excreting them.
Yeah. I think that's a really important distinction. Medication in general, especially when you talk about prescribed medication, one of the first things we do is a toxicity test, like what dose is this going to be toxic for somebody? And when we're talking about some chemicals that we might use to treat different diseases, I feel like that risk is at a much higher level. And we're talking about peptides as a little different type of a therapy. I can't say there's no risk ever to anything.
Ever.
And obviously this podcast is no way a medical recommendation of taking any medications or any peptides to anyone. We would encourage anyone that is wanting to use them to do them with the assistance of a medical provider to help kind of get them through it. And I also think a lot of it is just knowing what are the risks and making an educated decision. I think that's a big part of life.
Working with somebody with some experience and knowledge. And I'm definitely somebody that uses these myself. And have experienced a lot of benefits as a result of that. But one of the things to remember too, that once we get to peptides, the lifestyle has to already be in place. You have to already be living a life that is, that takes into account, good nutrition, good exercise, good sleep habits, all of these things. Peptides are for optimization. The groundwork, the foundation as far as lifestyle already has to be there. And the way that they produce an impact kind of just mixes across body systems. So some of the most popular peptides that we use are for weight loss, the GLPs, GIPs, semaglutide, and tirzepatide.
Yes, very big names there. You've heard of Ozempic.
The next most popular ones that we use in the kind of physical performance optimization community are the human growth hormone analogs or secretagogues. So those are peptides that help you produce your own human growth hormone more effectively. And human growth hormone is one of those hormones that starts to decline with age. And that will start to influence your ability to build muscle and maintain muscle, to break down fat. So those peptides would be things like tesamorelin, ipamorelin, which is commonly mixed with CJC, and sermorelin. I prefer tesamorelin, but everybody's a little bit different. Those ones can really help with muscle building and muscle maintenance, which we talk about in other podcasts, is the most important component of our long-term physical and physical health, heart health, brain health.
And you talk about the tesamorelin being your favorite, and that one does have, it's actually FDA approved to treat visceral fat.
Yeah.
Right.
It's FDA approved for
really good studies.
Really good studies on it. It's been studied in HIV patients. One of the main problems with HIV and a lot of the medication side effects used to treat HIV is that it causes sarcopenia, decreases muscle mass, and increases fat mass, which is
visceral fat.
Especially visceral fat, which is one of the largest components of our health. So tesamorelin has been well studied in this population for decreasing fat. One of the important things to remember with any of the peptides is that there is a law, according to the law of diminishing returns, the effectiveness that they have on your body will start to diminish with time. And we really want to allow your body to reset its own endogenous hormone
natural
function.
Cycle.
Mm-hmm.
Yeah.
So we usually cycle them 8 weeks on, 8 weeks off, and then work on muscle building and nutrition.
And then during that 8-week time period, it's important to do maybe 5 days on, 2 days off.
Yeah. So most of the regimens that we use will be 5 days a week or less, with kind of the weekend off. Wherever you want to do your 2 days off is fine. So we're not taking them every day. We're not taking them for extended periods of time. They really are like a health optimization.
Do you take them at different times of the day?
A lot of them are taken while fasting, first thing in the morning. Although some of the ones that help produce HGH, your human growth hormone, more effectively, can be dosed at night in order to help with circadian rhythm, sleep
2
patterns.
hours after eating carbohydrates at night.
Yeah, I think there's a lot of patients that come to me that are frustrated because they are exercising. They feel like they're eating a healthy diet. And back in their 20s, that was enough to feel and look the way they wanted to. And now they're 53 and they're doing those things and they're just not quite getting the results. And they don't want to go on testosterone necessarily, or they don't want to go on, what the anabolic steroids guy is doing over here in the gym. And they're trying to figure out, what do I do? And so I feel like this is one of those options that gives you an option that can just help kind of push you through kind of where you're at and make a little bit of an enhancement of the work that you're doing.
Yeah, agreed. Give you some results for your efforts.
Yeah, sure.
It's really nice to see results for your efforts every now and again.
And it's nice because you're actually boosting your body's natural HGH, the human growth hormone, as opposed to giving yourself exogenous form. And so it can just naturally boost that and help you build muscle.
Yeah. And when you're dosing these, you're not looking to become Arnold Schwarzenegger competing in a competition.
Maybe
when you're
you are,
just
but that's not our goal.
But it's not going to happen usually with something like a tesmorelin.
No.
Yeah.
So I think knowing that these are a little gentler than some of the performance enhancing medications that are out there, and I'm not pushing against everything. It's like everyone kind of has their own goals, but I just feel like it's nice for people to realize this has an increase, but it's not going to be to a level that feels maybe overwhelming or too much for somebody.
Yeah. The side effects from these medications or these peptides are pretty minimal. Usually they're gastrointestinal, they're site reactions. Anytime we're increasing your human growth hormone, we might make you slightly insulin resistant because when you break down fat, it increases your blood glucose levels. So that's something that I talk with patients about pretty specifically. If they're open to it, I start them on really low doses of metformin to help maintain their glucose levels, or we talk about natural supplements like berberine. During those 8-week periods where they're on the human growth hormone analogs.
Do you want to talk about a few more? Or?
Yeah.
Okay.
Listen,
let's hear it.
I could go all day.
I know. And it's obviously we can't do an exhaustive list, but I feel like maybe just talk about a few of your favorites.
Maybe we could have a visit in the office at some point about people's specific needs and what peptides are available for that. I get really passionate about health on a cellular level and on the function of mitochondria.
Mm-hmm.
And I do think that when we talk about just about any health problem, it will go back to the function of the mitochondria. And that's, inside this a cell, it's the powerhouse of the cell. That's what produces ATP, which gives us energy. And it's one of those things that starts to become less functional as we age. It starts to produce, and all the effects of less functional mitochondria produces systemic inflammation, which causes all sorts of problems with our brain and our heart and our muscles and the way that we function. So I get really passionate about mitochondrial health.
Mm-hmm.
And there are really good peptides that help with that. My favorite right now is SS31. So SS31 is one of those. It's actually completely synthetic. It is not found in nature. It has really good human studies on it, specifically for cardiovascular disease and macular degeneration, so age-related vision loss conditions, but also for its effect on, or for its impact on the efficiency of mitochondria to produce ATP. So especially me that has a chronic inflammatory condition, it's one that I have really appreciated for that.
Well, and I think for anyone, we all want to feel better. We all want to have more energy. We want to be able to, exercise at the intensity that we want to exercise at. And, this is not a peptide that I've tried yet, but it is one that I'm going to try. But I have been using a supplement that aids in mitochondrial health. And I've noticed even an improvement with that. So I'm so excited to try this peptide. But we've got all the behind the scenes things going on with our organ systems that require mitochondria to function. But then we actually have a physical change, something that we notice as we're going throughout our day, as we're exercising, where we actually know that it is working.
And has really good safety data, efficacy data. So I actually get really sad when I do my cycles off SS31.
Now, most of these peptides are injectable. Is that correct?
Yes, most of them are injectable. There are some, we'll talk about some that have oral forms that are actually effective, but they are going to be most effective when injected. And they are tiny, tiny little needles, tiny, tiny amounts of fluid. And they really aren't, unless you have a severe fear of needles, they really aren't intimidating.
Even if you do. I have a child who has a severe fear of needles. And I've actually started him on one of the growth hormone peptides, and amazingly enough, he is cured of it.
Just fine.
Yes. Does just fine. They do not hurt. Once you
start seeing the results, it really helps.
Yes.
I think it's good to answer why. Like, why are they injectable? Why can't you just take a pill?
Because they are more easily absorbed that way. When you ingest most of these, they don't actually survive the digestive process.
Right. They're peptides. Your body breaks down peptides.
They get
really
broken down so easily. That's part of why they're so safe.
There is some research going on, and some companies that are trying to make peptides in an adjustable, a digestible form.
By kind of mess around with some carrier proteins.
Exactly. And so I think that is on the horizon, and it is
exciting kind of future.
And we hope to be at the forefront of that. Should they prove to be effective?
Yes.
We will be our first test subjects.
Yeah. Tell me about SLU-PP.
Sloop.
Sloop. It's a great name.
Yeah. SLU-PP-332.
Yep.
So they all have super fun names. And they think they refer to it in the community as exercise in a bottle. That it has some evidence, and it is taken orally.
Yes,
it has some evidence that it helps you build muscle and reduce fat, even if you don't do anything. And I hate bringing things like that up. Like you don't actually have to work, but also improves endurance rates by 40 to 70%. Like it's a little bit outrageous. So this is one of those things that's really only available on the gray market.
At some point, yeah.
And Sean texted me and said, I don't see a lot of human studies. And I had to laugh at him and say, oh, Sean, you are the human study.
Yes, I will admit I have taken this one, and honestly, it is surprising the effect. Actually, my cardio workouts, and I do cardio with weight training, and I was surprised at how much of a boost it gave.
Yeah, you almost have to be careful because you feel like a little unstoppable during the workout, and then the next day you pay a little bit of a price, I think.
a little sore. Yes. I have been sore this month, but it's actually been surprising. I was surprised the immediate impact was actually surprising to me.
Yeah. So these are ones that we're discussing now that you have to get on the quote gray market, right? They will, and we'll have good resources for you on labs that produce these products for research purposes, and they will come in a bottle that says not for human use. And they do that for legal purposes because these are not FDA approved. So we're kind of on this little edge of medicine. Mainstream medicine takes about a decade to catch up with the research before all our formal guidelines change. So by the time, it becomes an actual medical practice, we're like over a decade behind on the actual research. So this is stuff that, we're kind of on the forefront of.
Yeah, I mean, some of the peptides are FDA approved.
Some of them are.
And we can get them at a compounding pharmacy or...
We're using them for an off-label use most of the time, but we do that a lot.
Yeah.
Most medications that we use are off-label use.
Yeah.
That's fair.
But we're getting into some that are not FDA approved, and we can give you really good resources on where to find these labs that have good purity rates, that are third-party tested, that are really open about their purity practices and the way that they compound these. SS31 is one of those. BPC 157 is also one of those. Used to be FDA approved. They've taken it off the FDA approval. So it is available on the gray market now. Really good for tissue regeneration and for healing. I like it combined with TB500. So these are really useful for healing. We have some that are really good for cognition, for brain health, and possibly for neurodegenerative conditions or depression and anxiety, things like Semax. I really like, I like to focus not just on physical performance, but on optimal cognition and mental performance. So I like Semax because it helps reduce oxidative stress in the brain and increase your BDNF, your brain-derived neurotrophic factor, and has some really positive evidence in human studies to support its use for that.
I think if you're listening, it probably sometimes feels a little overwhelming to hear all the names, all the different things, which is why I feel very strongly that having someone who has at least done the research and kind of knows what is out there and can give you, these are the pros and cons, this is what evidence is out there. It's information, and giving people information, then allowing you to make decisions with that information, I think is really kind of the forefront of what we're trying to do is we can't necessarily say this has got 20 years of an FDA study that says it does this. And it does have these really encouraging studies. It's on the forefront. We feel like this one's pretty safe, and these are the risks. And then we let people make decisions and what's the best decision for themselves.
Like the adults that they are.
Yeah. And I feel like people are ready for that. Like they want to know what's out there. And
a lot of them have medical conditions that they're looking for alternative solutions for. I'm running into a lot of people with chronic fatigue after COVID, a lot of long COVID kind of situations that I've been telling about the studies for thymosin alpha-1. gut health is really important and kind of a big thing right now as we focus on gut health and microbiome. BPC 157 is one of those that is available in oral form that is really useful for gut health and has some good evidence behind it.
Yeah, I mean, you have people who are so frustrated with gut health where they've got dumping syndrome, where they're going to the bathroom all the time, or they eat and it just goes right through and makes them sick every time they eat. Like, unfortunately, in medicine, we have not had great answers for a lot.
We're going to have to start to get real creative with our solutions.
Yeah. I mean, the reality is, you know, when you're talking about inflammation in the gut and you have something that helps fight inflammation, like, it feels like something that would have a real opportunity.
Yeah, something with very few risks.
It's something the body makes.
That is worth trying. And I know that just, you know, to go into my personal history, for me, as I have autoimmune arthritis, you know, through my whole body, and I've been on everything. I had been injecting myself with methotrexate, chemotherapeutic for years. I had been on all the TNF modifiers, immunosuppressants, and
Enbrel,
Humira.
who knows these medications, these have significant side effects.
We were about liver toxicity.
Yes.
I mean, it's a chemotherapy drug.
They are. It is. I was on chemotherapeutics for over a decade, and then I had a life-threatening Steven Johnson's reaction to rituximab. So it's an IV infusion. My arthritis was so significant that walking on we'd be on these call shifts for 24 hours, the way that we work in our profession. And the next day would be so painful for me that it would be difficult for me to walk effectively. And I had gotten to the point where I was doing rituximab infusions, which is a medication used for non-Hodgkin's lymphoma. And I ended up having a life-threatening reaction to it. So for me to decide that I needed to look for alternatives, that I needed to look into lifestyle. And I take a lot of supplements that help with inflammation, and I do a lot of physical activity that helps with that. And then was introduced to peptides and started experimenting with things that improve my mitochondrial health, which improves my systemic inflammation, and things that have some research, but, you know, aren't mainstream, but are relatively safe, that I can experiment with and see what it does for my systemic inflammation. You know, it also helps too. It's really fun that when you improve your metabolic health and your mitochondrial health, that it also does really nice things for the way that your skin ages. That's just a nice plus.
I'll just say that, like, hearing your story, I didn't know that you were going through those things. I didn't realize what your call shift was doing to you. And so hearing that you've been able to improve your health so much without needing these medications that are really hard on your body.
They're really hard.
Really hard on your body.
Monitoring my labs for my platelets
and you've been able
for
to
my
feel
liver
better
enzymes. And I have been off all of them for 3 years.
It's amazing.
Yeah, that's really a success.
And you do look, your skin's gorgeous. Oh, I'll just throw that out there too.
Just little pluses with being healthy.
Yes.
So, you know, having personal experience with a medical condition that modern medicine really couldn't help me with anymore, and having to look to more alternative therapies and kind of these things that are up and coming in medicine but aren't readily available or widely accepted. Right. Not yet. I do think they will be. That whole patent issue gets in the way of that. And then, you know, seeing people clinically who are really struggling with conditions, who have been to provider after provider after provider and are getting so tired, like no one's listening, so frustrated. That, you know, being a test subject myself in experimenting with some of these things and delving into what research and literature is available, so that we can try to help them. Yeah. But there will be a special consent form for that.
It is kind of exciting, though, to have options. Yeah. I think that's kind of fun with some of what's being introduced, and what they're finding is it's just kind of an exciting area of medicine where I think we're making some advances. You know, we're very slow in Western medicine to adopt new things. And so it does take time. We just want to make it as available as we can for people. And I think one of the hard parts is it's just so hard to find out, like, how often do I take this? What dose should I take? Or, you know, does it matter how old I am or what weight I am? And I think the answer to a lot of those is yes, it does matter. And so having someone to kind of help guide you through the process makes a difference. So I would encourage, you know, it doesn't necessarily have to be with us, but if you're going to be kind of going down this road, is to get with somebody who has experience and understands kind of what's out there so that it can be done in a safe way. And
some of these peptides are actually really good at cell proliferation. They're really good at regenerating tissue in that way. And so I worry about people who have, pre-existing tumors, even if they're non-cancerous. I worry about women with fibroids, taking HGH secreting analogs and, BPC 157 potentially. I have a friend I'm getting on, peptides who just had a huge liposarcoma removed from his abdomen. And we worry about existing tumor cells still in there. So we have to be really careful about which peptides we give them because we don't want to encourage the proliferation of any of these cells. Yeah. So you can see that there are certain medical conditions. And like I said, increasing HGH in somebody's body can make them more insulin resistant. So we have to take precautions for that and then make sure we're cycling off these things appropriately, monitoring lab values. So there are a lot of things to consider, even though they are relatively safe.
But we can't forget
that these things exist.
Yeah, it's a human body. It's not always easily predictable. And so having a little bit of guidance, help is not a bad thing.
And it just brings a whole nother set of options. We don't have to stick to what mainstream medicine has been offering. We have other options that we can have the discussion about to see what might be best for someone.
Yeah.
And it's nice not to restrict people access to those and still provide them with some sort of medical guidance.
Exactly.
Well, we should talk about Vyleesi too.
Okay. Go right ahead.
Just because this is one of the top 3 things that we talk about in women's health, right?
Yes.
Which is sexual dysfunction.
It is.
So, there is another FDA approved peptide for sexual health and hypoactive sexual desire is the medication called Vyleesi, which is a peptide, PT141, and it is. I have really struggled in our practice because it is so expensive and it is so difficult to get. But it is really effective. So it's an injectable peptide that can be injected 30 to 60 minutes before intercourse, improving sexual desire and the sexual experience. But I have found a compounding pharmacy that will make it for us and in bulk at much cheaper prices. So I'm really excited about that. So
amazing.
From everything to brain health to cardiovascular health to improved insulin resistance to mitochondrial health
to sexual health
to systemic inflammation, and then if you just want to geek out over physical performance,
who loves to talk about
come talk to
what's
Jen.
out there. Jen is there. Well, I'm excited. I think this is just a really fun part of kind of where medicine's going. I think there's a lot of new, exciting therapies out there, which I think will be fun to talk about. So thank you. Are there any resources that you recommend for people to look at for kind of get more information? I know this one's tough because there's so much out there and it can be very varied. So this one might be a tough one to have a specific site to go to, but maybe there's something that you really like.
It's really hard to think of specific places that I refer people to. As far as buying peptides, I think Peptide Sciences is a pretty good resource that's really open about their purity levels and their compounding methods. All the resources that I use that I kind of keep up with kind of vary on their the accuracy of the information that I feel like I get. I'm kind of gleaning from multiple sources all the time and kind of accepting information and rejecting information. So I would say let's if it's something we want to talk about, let's sit down and geek out on that together.
Fair enough. Yeah, I think this is one that's tough to give you like a specific go to this.
Yeah.
So it's a good one to kind of individually kind of address and say, okay, this is what I found and see what you think.
Mm-hmm.
Okay. Well, thank you so much for your time. Once again, this is the Valley Wellness Podcast sponsored by Valley Hormone and Wellness Clinic. And we were so glad to talk to you today.